Welcome everyone. What could be another lucky day for me to host to welcome Dr. Nikhil Srivastava Sir, a pediatric dentist, a legend in himself, pass out from KGMC Lucknow, principal, PG guide, whatnot at Subharti University, principal dean also, and Subharti Dental College Meerut, UP. He's a DCI member, he's IDA representative, and I don't know. And like if I start talking about Dr. Nikhil sir, it will be half an hour only that part. Another one thing which I always love to quote is, sir, your sir has a patent appliance, space maintainer appliance, which is called With Love, Dr. Nikhil's Appliance. You can read any textbook of pediatric dentists and explore that. Welcome, sir. Thank you for giving time today for this.
Thank you, Dr. Amit. Thank you.
Sir, we are here for a very sincere, serious topic regarding scope of pediatric dentistry in India, abroad, majorly. In India, we have to think on these lines, now the counseling procedure is about to start, and many MDS aspirants who have got rank this year, they look forward to know what exactly they are going to do in the branch in 3 years. So what is the scope of pedodontics in 3 years of MDS training, learning in your experiences, sir?
Thank you very much, Jai Hind. Very good evening to all, one and all. The scope of pediatric dentistry is so vast that it is very difficult to describe in sentences, I'm telling you. I myself have been the pediatric dentist, a student of pediatric dentist. Still, I am the student. I'm learning every day, one or the other thing. But, India is the youngest country in the world. Now, if you see the statistics, you will find that 30% of Indian population is below 13 years, right? Now, if you convert it into crores, you will find close to 40 crores or more than that. Now, I happen to be the Secretary General of my own association. That is why I have the exact data of total number of pediatric dentists in India. So at present, we are approximately 5,000 and few hundreds, okay, 5,200 or 300 pediatric dentists. Kindly see the scope. Now, another systematic review which was conducted in 2021, 2022, you will find that more than 50% children population are suffering from dental diseases. That means they all require us. That means that we need them. We need, they need our services, and we need to, cater the services. The problem with this is that in other colleges, the pediatric dentists, they after passing out, they indulge or they start their general practice sort of thing. And somehow the children dentistry, goes on the back stage. As a result, Indian population, which is the young, who are the future of the nation, I mean, they are still suffering from a lot of dental diseases. So I have to, tell the aspirants that if you want to see the scope of pediatric dentist, it is so enormous. Most of the dentists are unable to handle children, unable to treat them. And as a result, what we call it as cow type of treatment, when these children visit to a general dentist, they just give you some, antibiotics, sometimes calcium tablets, and they often say, because they themselves are unable to treat them, so they always say, okay, after some time, these will fall off, these primary teeth will fall off, or milk teeth will fall off, and nothing will happen, without realizing what can be the long-term sequelae and consequences of losing the teeth before time. So I just want to tell you the scope is enormous. The only thing, you must have that passion to serve the younger members of the society.
Yes, sir, very true, sir. Even like in my own practice, I am little afraid handling kids. My wife does. So it is a normal thing, sir. When we don't know a procedure, we try to get rid of that.
Yeah.
Like we try to push it to some other way, but not doing justice to the patients and their treatment.
Correct.
Sir, many BDS students who are going to take MDS this year and many years in the past, they have been asking me one very sincere question, like what they have seen pedodontics in BDS college days. And what is actually the MDS in pediatric dentistry in 3 years? Like, what is the major difference? Because many a times we feel like we get to listen to students that usually like the same procedures are maybe being done in the MDS part also, or the MDS periodontic PG student is doing way beyond what we imagine at BDS level.
Yeah, actually, Dr. Amit, there is a huge difference at undergraduate level. In undergraduate in third year, you have 1 month of postings,
Yes, sir.
final year 1 month, and internship
But
1 month. So 3 month
1 month, yes.
posting, and actually the effective days are almost between 70 to 80 days, right?
Yes, sir.
What they get to learn, I mean, they just go for few fillings and scalings and then mobile extraction. That's all.
Yes, history.
Done. It is nothing. I mean,
Yes,
this
sir.
can be done by a hygienist or a dental mechanic also. So they don't learn anything. And now people may ask question, then why we are not taught sufficient pediatric dentistry in undergraduate level? But the main reason is because the behavior management of the children is a very, very unique and a specific thing, okay? In 1 month posting or in 20 days of posting, you can't learn how to manage behavior. And until you manage the child well, I mean, it is immaterial how efficient or how effective a dentist you are. So when you come to pediatric dentistry, now, as we all know that initial 6 months will be utilized for completing some preclinical exercises. But the moment you get into the clinics, you start with the simple procedures. For example, the pulpotomies, the endodontic procedures. Later on, we go on to the pulpectomies, the crowns, and now it is all divided into 6 sub-specialities. Now, I just want to make it clear to all the aspirants who want to pursue post-graduation. We divide into 6 like preventive pediatric dentistry. What they get to learn all these things, all the preventive aspects, starting from the space maintenance to SDF application and varnish application and all these. These are relatively simpler procedures. Then you go on to pediatric restorative dentistry. Now, this involves all sort of restorative material. Now, in endodontics, usually they are concentrated on ceramics. Okay, that's all. But here you will see a number of modifications of glass ionomers. Then you go for intracoronal restorations like geomas, then composites, and then extracoronal restorations. Now, in prosthetics or endodontics, you have to take the impression or you have to scan the impression and send it to the lab. And then whatever lab people do, you have to just elute it, okay? But
Yes,
here
sir.
we have a lots and lots of preformed crowns, starting from the stainless steel crown
Stainless steel.
to the bioflex crowns, to ceramic or zirconia crowns, to strip crowns, to polycarbonate crowns. So number of crowns are there for them to do it, right? Then you go into the endodontics, right? Endodontics, right from all vital pulp therapies and non-vital pulp therapies, probably we are the only specialty who deal with 48 teeth instead of 28 or 32, 20 primary,
Seriously, sir.
28 permanent, okay,
We
until
never thought,
the
we
age
never
of
looked
15.
at it like that actually. Never.
Absolutely. So you get to learn all sort of endodontic procedures. And if you visit my college, you will find only initial 10 to 15 root canal therapies and pulpectomies are done manually. Otherwise, it is mandatory for everyone to do it on rotary endodontics, right? So that becomes the pediatric endodontics. So pediatric preventive dentistry, pediatric restorative dentistry, and pediatric endodontics. But then we go for pediatric oral surgery, right? Now, our students are posted in emergencies in association with oral surgery. So whenever there is a pediatric trauma, so the team involves one pediatric dentist. So they have to manage all sorts of non-surgical management of a child, right from impression making to making the splints, then following up. And many a times, they require endodontic therapy, pulp therapies, then mouth opening appliances, or we call it as oral physiotherapy. So all these things are done in pediatric oral surgery. Apart from this, we have a lots and lots of periodontal procedures. Okay, so right from the depigmentation in the young children, because they are very, very aesthetic conscious. So 13, 14, 15 years of girls, they invariably come that they have a gum problem, you have to treat them. So pediatric periodontology is also an integral part. The frenal attachment. So the management of the lingual frenum or the label frenum. So this all comes under periodontology. And then we have lots of preventive as well as interceptive orthodontics. So making the 2x4 appliances, 2x6 appliances, interceptive therapy like twin block therapy, right? Myofunctional therapy,
Biofunctional.
and now the early age orthodontics with clear aligners is the new era. So actually you get to learn almost all aspects of dentistry, but pertaining to the children and growing. Until the population is growing, it is your domain. You can treat that. So that's a
That's a
huge
very
work.
great
Yeah.
insight on this, sir. Nobody actually, I don't think most of us knew all this except the pediatric dentist in the country.
Yeah, one more thing, I just forgot it. Now,
Yes.
we have 2 days of OT, yeah, in
Okay, sir.
uncooperative children and children with special healthcare need. Now, they require treatment to be done under general anesthesia because they
Conscious
are not
sedation
cooperating.
and general
Uh,
anesthesia.
Conscious sedation is actually, it is kept in the postgraduate clinic. They do it on their own. But for general anesthesia, no, the patients are
OT.
taken to the OT and then they are treated. So that is also one of the important thing and very unique thing for pediatric dentistry.
Sir, learning all these, like suppose I am doing PG in pediatric dentistry, and in those 3 years, I find myself more lucrative towards orthodontics or say endodontics. So can after passing out, I explore more avenues into ortho or endo and start working as an orthodontist or an endodontist in like after passing out? How does it sound like?
Actually, most of the pediatric dentists, they are, called by general dentists to perform endodontic procedures. This is
Yeah.
a fact, actually. Now, I tell you one story, one of the practitioners in my area, he once came and he said, sir, I have a lot of patients, but then I'm unable to do it. So I need either the endodontist or pedodontist or pediatric dentist, because I have a lot of cases, which require endodontic intervention. So I said, why don't you look for only the endodontist? No, why pediatric dentist? So his reply was very simple that the only pediatric dentists, they deal patients in a very softer manner. So even if they have a problem, because the way they deal adult population, it is remarkable. That is why we want pediatric dentists also. Now, second thing is regarding the orthodontics. I'm telling you that we do a lot of early age orthodontics. You can do it. The only thing, because I happen to be the dean of the college, I cannot allow everything related to orthodontics in pediatric dentistry because we have our own orthodontics department.
Why I ask this is you being a DCI member also, you know the legalities and the constitutional parameters. Is it like legally allowed like a pediatric dentist doing a lot of ortho cases, maybe up to the age of 14, 15 and not beyond that? Well, is it legally sound? Like,
Actually, see, pediatric preventive dentistry and pediatric interceptive dentistry is a part. Orthodontics, the corrective orthodontics, which includes the extraction cases, the skeletal deformities, these patients should be referred to the orthodontist.
okay.
But otherwise, it is happening, and it is not the competition. I'm telling you, if the orthodontists are listening to me, they would understand that we prepare good patients for them. Because early age orthodontics means phase 1 therapy. So we do only phase 1 therapy. Now, as per the literature, almost 45% of phase 1 therapy patients, they land up into the phase 2 therapy also. So we always make good patients for them. So it's not a competition. It is early age, and then there is a gap, and then the phase 2 orthodontics can be done by orthodontists. Right?
Yes, sir. Sir, in relation to the specialty, like please don't mind, and this is a question coming from a lot of viewers. Is there any gender bias when we call MDS in pediatric dentist? Like, is it a branch which is like being tagged only for girls, or well, I'm asking a man, like a learned man, this question. Firstly, the question is not right asking you because you being not a girl. But still, sir, like we see maximum like girls going with this branch, maybe like due to kids factor, or what is your expertise and experiences in this regard?
Yes, you are right. There is no gender bias, but to be very frank, now in my college, we are close to 102 postgraduates. And in
Yes.
102 postgraduates, there are only 4 boys. All are girls. Whole endodontics is girl. Even oral surgery is all girls.
Yes, sir.
Pediatric industry all girl. What to say now? There is no gender bias, but then because the boys are considered as little aggressive, so they lack, sometimes they lack the patience, okay, to deal with children. That is why sometimes it is said that okay, it is a branch for females. But I don't think so. I mean, in today's era, every patient, whether the adult patient or a child patient, he needs a very good counseling, a very soft hand, very soft voice. So this is just a myth that it is a branch for the females. However, I mean, you can call me as a gender bias because I always wanted that, okay, there should be a balance maintained. Few boys should also come, few girls should also come. But then what is happening here? The boys, they do not qualify. If they qualify NEET PG, I mean, they are very low in marks.
So girls are
Even if
topping
I
the
say
charts everywhere,
girls are
actually.
topping, if they are topping, they just join us.
It's good,
So,
like
yeah, I
overall.
mean, in oral surgery, I'm telling you, Dr. Amit, in my college, oral surgery is such a tough branch, and every day, you have one or the other trauma case where, midnight, you have to call the residents. These are all girls. I mean, we kept on telling that this is not a very good branch for the girls. Until unless you have a medical background where your husband or your father is a hospital, then it is a good branch because then they will take care of rest of the things. But somehow there is a fascination. So everywhere in dentistry, 70% are girls, only 30% are boys.
Yes, sir.
And this ratio, further worsen when you go for post-graduation because it is
Postgraduate exams.
yeah.
Overall, sir, boys are less studious, it seems like.
Absolutely, absolutely.
Sir, that
They are distracted as well. Distracted as well. I
yes,
mean,
sir.
they will show that they
Sir,
are preparing NEET PG, but somehow, when they appear for the PG examination, the marks are not coming.
this makes me ask you, sir, another question on the same, rotating around the same bush. What, according to you, are the perfect traits like for somebody, a BDS graduate, to become a pediatric dentist? Like we say, na, there has to be some qualities and some, you can say, missing things which will make you grow as a pediatric dentist in a longer run. Like for every branch, I believe there are certain traits. So what are traits according to you for pedodontics?
Well, I think it is not only pediatric dentist, for every professional. I mean, we call it as 3 Ps. So one is you have to be passionate. You have to literally love your profession. I mean, no clinical branch, or in fact, no the health sciences branch is good or bad. I mean, I have seen homeopath and Ayurveda, they are doing exceedingly well. All branches, even you know this thing about Dr. Raju Desai, I told you the next day, he's an oral pathologist. Dr. Sandesh Maikar is an oral pathologist. I mean, they're also doing very good. I mean, so first thing is that you have to be very passionate. Second is you have to be perfectionist. Whatever you want to learn, you have to just devote some time, take the guidance from your teachers, and then books also to be consulted, and then you start making, yourself a perfectionist, and compete with yourself. Now, I tell you, Dr. Amit, in my department, when they start pulpectomy through rotary endodontics, they take almost 1 hour, okay? So, but after 10 or 15 pulpectomies, the time goes, brings down to 45 minutes or something. I always tell them that you have to compete with yourself. That if the patient has come, 10 minutes, you have to manage the child. Another 20 minutes, you have to complete the pulpectomy. Keep your stopwatch and you compete with yourself. The last time I, took 45 minutes. This time I have to finish within 40 minutes. So this perfection is needed. That doesn't mean that you will compromise with the quality. Quality has to be there. So perfection, then passion and perseverance. What we call is perseverance. Perseverance, you have to do it again and again until you achieve that perfection. So these 3 Ps are important, particularly for pediatric dentists. You can say the patience can be the 4th P, because dealing with the children, you require a lot of patience. So you have to just sit, listen to them, just convince them and make a good report before you start the treatment.
Plus, like you mentioned, soft spoken skills,
Yeah.
soft hands,
The patience,
So,
it includes everything in the patient. If you are a patient, no, then you are very soft. I tell you one example. No, I always tell to my students that there's a the saying in the Bollywood. No, there is a real life and real life. Okay, now if you see in dentistry, there is also a real life and a real life. Now, real life is that when you give a shot and shot is not perfect, you say cut. Okay, do it again. So this becomes a real life. And real life is you are performing something on the stage where you cannot go wrong. Otherwise, the tomato will come. Okay. So similarly in dentistry also. Now in adult dentistry, prosthetics, endo, ortho. Now supposing you have injected LA and the patient screamed. Okay. You will say, oh, sorry, just wait. Okay. I'll inject it again. Okay. So that becomes, it's a retake. Okay. The patient had a pain and you elicited the pain. But then you say, okay, sorry, I will do it again. Okay, just sit down. And patient will keep quiet and he will allow you to do it. So this becomes a real life. But in pediatric dentistry, it is a real life. It is a stage show. The once you have heard the child patient, he will not let you touch now. So for that, now you need patience. Now, first you convince the child behavior, you have to modify the behavior, then you start the treatment. And I'm telling you, once the child is convinced, he becomes your very good patient, not only the child patient, but the father, mother, and until the child grows. And I tell you, if you just go, one of my students, when I was there in Yamunanagar, he was a very small kid, I think 7, 8 years. He is a grown-up engineer now. And he is still in contact with me, and he had my website, okay, with my name, saying that, said, doctor, when you had done a treatment, I still, it is all in my mouth, and I had performed some surgery. I still not remembering. But then these patients become your lifelong patient. So you can always do it. The only thing that, as I said, that you have to be little, patient.
yes, sir, only one take. So all the viewers of this video, remember in periodontics, you have to have one take. Like Amitabh Bachchan, like Rajnikant, like Nikhil sir. Simply one take. If the child is not happy with you, then the problem starts.
Yes.
That's the challenge you have. The branch will pose to you, but you will emerge as a winner if you crack that code. Sir, another important aspect, we are seeing a lot of, not everybody ends up taking periodontics in a government college. Many go to private colleges like your college and many colleges in India. One question which may not sound very, you can say, clean and good, but that is what the audience wants to listen is spending lakhs of rupees on pediatric dentistry in India worth it? Like, will they be able to earn after passing out?
See, Dr. Amit, I come from a medical family, okay. Many of my cousins and then uncles, they are from medical field, okay. I have seen them when they pass out, how much struggle they have done to reach to that position. Similar is for us also. And similar is for pediatric dentists, or for that matter, any branch of dentistry, right? You have to initially invest, you have to learn, unlearn, relearn, keep on investing. And as if my listeners have attended any of the practice management lecture, then they would exactly know that initial 3 years you have to spend from your pocket. I mean, whatever you learn, you have to invest some more money also. You might be in losses. Then after 3 years, you become, a balancing attitude that how much, whatever is coming, I mean, it is being spent. So you don't get to, save money. It is only after 5 years that you start saving money. So pediatric dentistry, I'm telling you that if you are capable, and if you just show your work to the practice, I don't say that you start practice right from beginning because it is a costly affair, right? But once you start, then there is no ending, there is no back seeing. I'm telling you, I feel very proud by seeing my own students. They are doing so good wherever they are. And they have not left the pediatric dentistry and ventured into the adult dentistry. No, they are still doing a lot of pediatric dentistry. They have kept people, they have kept pediatric dentists. And I tell everyone, no, there is one person who's known, who is Dr. Kunal Gupta. He's in Gurgaon, and he runs a center like Children Dental Center, CDC, in a mall. Okay, please visit that. He has no time to talk to you even. I mean, if you call, he will not be available. He is doing that. He's a young boy.
Same is the situation na. BDS to MDS team,
Yes.
Dr. Vivek Gaurav sir,
Vivek
who
Gaurav.
teaches pedodontics in our
Correct.
academy for last more than a decade. All those who don't know, he's a student of Dr. Nikhil sir only, proud student I would say, and runs a roaring pediatric and general dentistry practice in Dehradun.
Absolutely.
He has no time sir. मुझे विवेक सर से बात करनी होती है, मैं मैसेज करता हूँ, निखिल सर का मैसेज है, तब वो मेरा कॉल उठाते हैं. This is the easiest way to catch hold of him.
Yes,
And
and there are so many. I mean, Dr. Richi, I mean, if you know Dr. Richi, she is in Kolkata. She is doing such a good practice. She is very busy and she is doing only in under GA because very small children are coming, those who cannot be handled by anyone, even the pediatric dentists, those who don't practice general anesthesia. So all the patients are being referred to her. And I mean,
it's about building
financial
confidence
matter,
in a
but
procedure, sir.
only treating 2 children in a week under GA. You get to learn, you get to earn close to 1.5 or 2 lakhs. Okay. I mean, you don't bother much. So sky is the limit for you. The only thing that it is a tapasya for 3 years. You have to really work hard, be very passionate, be a perfectionist, and then you see your future is very bright. So don't say that spending money will be worthless. No, I'm telling you, whatever you earn, whatever you spend here, close to say 25 lakhs or 30 lakhs, this is the in general, fee in
Yes,
India.
sir.
But this you will be able to recover within 2 years or 2.5 years. That I can guarantee.
I personally believe the word spending is not a right word, which even I
Correct.
used. I'm sorry for that. It's more of investment.
Yes,
When
it
we
is.
are talking about education, it's not we are spending, it's not we are buying pizza or burger. We are
Yeah,
investing in our own selves,
absolutely.
getting learned from teachers like you, getting more accustomed to new procedures,
Yes.
building confidence over a period of time, and that will automatically pay off once we start doing work.
Absolutely. Now I tell you one example. No, one of my friend, no, he has done general medicine. Okay,
Yes, sir.
after completing MD in general medicine, no, he started his own clinic. Okay, now how much can you see that he can keep consultation charges? 500 rupees to start with, not
And
more than
Delhi,
that,
sir,
because the
500.
people will
Yes,
not
sir.
know. Now,
Yes,
if he takes 500 rupees and if he gets 10 patients a day, which is a big number
big
to
number.
start with,
In the
okay,
beginning, yes, sir.
in the beginning, what you are earning, which is very, very less, 5,000 rupees a day, that means 1.5. And after spending you just get 1.2 or something like that only. Whole day. So and how much he has spent now in my college only, the fee is close to 17 lakhs, okay, per annum. So it is actually after a few years when you start earning. Initially, it is an investment.
Some medical dental doctors, doctor profession was never meant to be like immediate payout,
Yeah,
I believe.
absolutely.
Like, even if we get a job in a government college or a private college, there is not going to be so high a payout on the immediate basis.
True.
With time, with experience, we will definitely earn more.
Yes. Aman, even if you join a college, no, I always suggest to everyone, you are the young, you should not stay back at 4 o'clock. After 4 o'clock, you must go do consultancy. I mean, even if you do only 2 cases now, telling you pediatric dentistry now, our students are very, very perfect, very good in pulpectomies and crowns. So if you do only one pulpectomy, one crown per day, you get to earn close to 6,000 rupees. Okay, every day if you treat only one patient, 5 to 6,000 rupees, you just keep in your pocket, you come back. Okay, so this will compensate you because the colleges cannot give you a huge salary, but college will give you name, fame, and the satisfaction, right? And financial aspect you can just do by doing consultancy or you're opening your own clinic.
That's a great idea. All those who are listening, once you pass out, if you're getting a good college attachment, definitely join it, expand your horizon of learning new things,
Absolutely.
doing maybe research work, publications, and in the evening, spend time doing your consultations. That
Yes.
will make you happy both ways, academically also and
And
financially also.
financially also. Correct.
Yes, sir. Sir, it was great discussing all these to you. It can go on and on. But one last question, if you allow me, for this session today. Uh, in your own department, you have been guiding, teaching, mentoring postgraduates for many years now. What all, like once you see a PG student completes 3 years, what all procedures he or she is, you feel proficient in those procedures to face the world nicely?
See, I'm a very clinically oriented man, okay? Unlike many of my friends in the South, who are very theoretically oriented, okay? In my style of teaching as well as taking examination is all clinically oriented. So I have seen the market because I myself is a practice, I just practice exclusive pediatric dentistry. So I have seen maximum patients, 70% or 75% patients, they come with the problem of endodontic intervention and followed by the full coverage restrictions, okay? So I always teach my students that you should be very, very good in endodontic procedure, crowns, interceptive procedure, and preventive procedure. These are 4 things if you learn, because 80% patients are going to come here and they pay you a huge amount. Okay, so my students, when they pass out, one, they are very good in endodontic procedure. They are very good in restorative procedure, particularly the full coverage restorations. They are very good in interceptive orthodontics, and they are very good in dealing patients under conscious sedation and general anesthesia. These are the USPs, and I'm telling you the forthcoming sub branches of pediatric dentistry is, one is the sports dentistry, and second is the adolescent aesthetic dentistry. So I'm currently focusing on these 2 aspects. And I have, I'm one of the advisors for the sports authority. We are now looking that how can the pediatric dentist be involved in the sports, right? The prevention of the sports injuries, and how can they manage in case the injuries occur. And the pediatric adolescent aesthetic dentistry is also new era. Girls of 13, 14, 15 years, they are very aesthetic conscious. So they are coming with a lots of aesthetic concerns. So now my focus is in these 2 areas, and I'm sure in years to come our students will be very, very good in these 2 areas also.
Great, sir. That is, the branch is expanding, the scope is expanding. Everybody knows. Like, even sir, when we have been talking to other specialty people like you, they also, I don't know how and why, suddenly everybody is, you can say, saying that future of India will be more of pediatric dentistry than endodontics and the routine specialities. This is a hard fact, but yes, listening straight from you means a lot. Sir, एक last just एक thought आया था एक और question का. Does like, is there any criteria, is there any parameter to be like these many patients should be done in a year by a postgraduate in first year, second year, or third year? That will is like, you can say, a minimal criteria or will make him or her competent enough to face the world. Because we see many, I'm asking this because many colleges, the OPDs are not that great enough like yours. But still there, according to you, there has to be some line ki itna kaam to kara hona chahiye to call yourself as an MDS in such a big specialty.
Yes, Dr. Amit, see, what I personally feel that because the endodontics 70% patients are coming with the endodontic problem. So I personally feel that at least you should have done 50 to 60 pulpectomies or root canal therapies, 25 to 30 full coverage restorations, at least 5 full cases of interceptive orthodontics, at least 5 to 10 cases of under general anesthesia, and maybe 10, 20 cases of under conscious sedation. I think that will make a good pediatric dentist.
It will at least some competence, you can say. बाकी तो lifelong learning curve चलता रहेगा, sir.
Yes, yes.
Yes, sir. So great, sir. Like, it's been really pleasure always interacting, listening to you, your kind words, your words of wisdom on dentistry, on pediatric dentistry, and maybe actually more than that, because I know I have been interacting you for quite many years now. जब भी आपसे मिलके जाता हूँ कुछ एक अलग नया इंसाइट लेके जाता हूँ सर वहां से.
Thank you, Dr. Amit, and you have been a great help
Thank
to
you.
us also, क्योंकि हमारे स्टूडेंट्स को जब जरूरत होती है किसी पोस्ट ग्रेजुएट मेडिकल एंट्रेंस तैयारी करने के लिए, and I always look for you, and then I always suggest blindly that go meet Dr. Amit Lall. He'll be able to guide you in a nice way. And I think a lot of our students have been your students also, that is studying and they're taking guidance from you also.
Thank you very much, sir. Thank you for giving your time.
Thank you, Dr. Amit. Thank you. All the best to all the listeners. And I hope that they will opt good branches of their own choice and they will excel in their field. And just one last word, dentistry has enormous scope in years to come. The only thing, you should be very passionate, you should be perfectionist, you should have patience, because the success will come gradually. Sudden success will not come. So you have to be little patient, and I'm sure there is no reason that you will not be succeeding in your life. And that is why probably the health or the medical field is considered much higher compared to any other profession, because you can serve the humanity till the last breath of your life.
Yes, sir. So no matter what good or bad situation in the world,
Yes.
doctors are always on the top.
Yes.
Like
Absolutely.
you. Thank you, sir. Good day, sir.
Thank you.